Herpes simplex disease is a common viral infection caused by the herpes simplex virus, HSV, which primarily affects the skin and mucous membranes. It is characterized by recurrent episodes of painful sores or blisters, most often occurring on the mouth or genital area. HSV infections are lifelong, with the virus remaining dormant in the body and reactivating intermittently, often triggered by various factors such as stress, illness, or immune suppression. Types of herpes simplex virus. There are two main types of herpes simplex virus. Herpes simplex virus type 1, HSV1, traditionally associated with oral herpes. HSV1 primarily causes cold sores or fever blisters around the mouth. However, it can also cause genital herpes through oral genital contact. Herpes simplex virus type 2, HSV2, primarily responsible for genital herpes. HSV2 causes sores or blisters in the genital and anal regions. HSV2 infections are generally more recurrent than HSV1 in the genital area. Transmission. Herpes simplex virus is highly contagious and spreads mainly through direct skin-to-skin contact with an infected person. Transmission routes include oral herpes. HSV1 usually spread by kissing or sharing items like utensils, lip balm, or razors with someone who has an active cold sore. Genital herpes. HSV2 and sometimes HSV1 spread through sexual contact, including vaginal, anal, or oral sex with an infected partner, even when sores are not visible. Asymptomatic shedding. Mother to child. HSV can be transmitted during childbirth if the mother has an active genital herpes infection, posing risks to the newborn. Symptoms and clinical presentation. Herpes simplex disease often has two phases: the initial infection, primary, and recurrent episodes. Primary infection. Symptoms typically appear 2 to 12 days after exposure. Painful, fluid-filled blisters or sores develop at the site of infection, commonly lips, mouth, or genital area. The blisters rupture, leaving painful ulcers that crust over and heal within 2 to 4 weeks. Other symptoms may include fever, headache, muscle aches, swollen lymph nodes, and malaise. Primary infections tend to be more severe and last longer than recurrent outbreaks. Recurrent infection. After the primary infection, HSV becomes dormant in nerve cells. It can reactivate due to triggers like stress, illness, sunlight exposure, hormonal changes, or immune suppression. Recurrent outbreaks usually cause milder symptoms, such as tingling, itching, or burning sensations before blisters appear. Lesions typically heal faster, usually within 7 to 10 days. Diagnosis. Diagnosis of herpes simplex disease is usually clinical, based on the appearance of characteristic sores. However, laboratory tests can confirm infection. Polymerase chain reaction, PCR, detects HSV DNA from swabs of lesions and is the most sensitive test. Viral culture, growing the virus from a lesion sample, though less sensitive than PCR. Blood tests, detect antibodies to HSV1 or HSV2, indicating past or current infection. These tests can help distinguish between types but cannot pinpoint the location of infection. Treatment. There is currently no cure for herpes simplex disease, as the virus remains latent in nerve cells indefinitely. Treatment aims to reduce the severity and duration of symptoms, prevent complications, and decrease transmission risk. Antiviral medications, drugs like acyclovir, valacyclovir, and famciclovir are commonly prescribed. During primary outbreaks, antivirals help heal sores faster and relieve symptoms. For recurrent episodes, they reduce duration and severity. In some cases, daily suppressive therapy is recommended to reduce the frequency of outbreaks and lower transmission risk to partners. Symptomatic care, pain relief, topical anesthetics, and proper hygiene help alleviate discomfort. Complications. While herpes simplex disease is usually manageable, it can cause complications. Neonatal herpes, serious infection in newborns transmitted during childbirth, potentially causing severe neurological damage or death. Herpetic whitlow, painful infection of the fingers caused by HSV. Herpes encephalitis, rare but severe brain infection caused by HSV1, requiring emergency treatment. Increased risk of HIV, genital herpes ulcers increase susceptibility to acquiring or transmitting HIV. Prevention. Preventing herpes simplex disease focuses on reducing transmission. Avoid direct contact with active sores. Use barrier protection methods like condoms during sexual activity. Avoid sharing personal items that contact the mouth. Pregnant women with active genital herpes near delivery may be given antiviral therapy or consider cesarean section to prevent neonatal transmission. Living with herpes simplex disease. Herpes simplex is a chronic condition that can impact quality of life emotionally and socially due to stigma and recurrent symptoms. Education about the disease, open communication with partners, and adherence to treatment plans can help manage the condition effectively. Many people with HSV live healthy lives, experiencing only occasional outbreaks. Support groups and counseling may benefit those coping with diagnosis and emotional challenges. Summary. Herpes simplex disease is a widespread viral infection caused by HSV1 and HSV2, affecting the skin and mucous membranes primarily in oral and genital areas. It is highly contagious, transmitted mainly through direct contact, and remains in the body for life, causing recurrent episodes. Though there is no cure, antiviral treatment can manage symptoms and reduce transmission. Awareness, preventive measures, and proper medical care are key to controlling the impact of this common but often misunderstood disease.